Hi, my name is Laura Chanchan Parajon. I'm a mom, family practice physician, and public health doctor, and part of a team here at AMOS Health and Hope, a Christian nonprofit organization working to reduce health inequalities here in Nicaragua, the second poorest country in the Western Hemisphere. At AMOS, our team is passionate about community empowerment and social justice. A poor child anywhere in the world does not have the same chances for life as a child who is not poor. In Nicaragua, babies still die of completely preventable diseases, and a poor baby is still 3 times more likely to die than a baby who is not poor. And for us, this is a social justice issue. So how does AMOS address health inequities? We use an approach called community-based participatory research, or CBPR. So why research? Research has great power because it generates knowledge, and that knowledge is power that can shape policies and programs. Traditional research often occurs in cities or in universities with professionals, yet the problems are in the communities. We need information and data from the community to make sure their voices are heard and that they are part of the solution. At AMOS, we use the CBPR Framework developed by Dr. Nina Wallerstein, Bonnie Duran, and their colleagues at Engage for Equity. This framework helps AMOS as an organization to both plan and evaluate how well we are partnering to get to our goal of decreasing health inequities. The framework consists of 4 components: context, partnerships, programs or interventions, and outcomes. We will walk through each of these components with 2 people we know and love: Socorro, who is an AMOS community facilitator, and Timotea, who is one of our community health workers called a promotora from the community of San Onofre in rural Nicaragua. The first component of the framework is context. Context starts with a problem of importance to the community. AMOS helps communities to identify problems using methods like community mapping or analyzing census data. Today, Socorro is working with Timotea and her health committee on the problem of malnutrition for children. Context is also the background which shapes the nature of our work. In San Onofre, this includes factors such as poverty, an extended drought, unemployment, and food insecurity, all of which affects malnutrition in children. Context also includes strengths such as AMOS's history of a long-term commitment to the community, a strong health committee, and church with the capacity to partner with AMOS and the government health system. Context influences the nature of partnership, which is the second component of the framework. Partnership at AMOS starts with just showing up and being there in places where most people don't go, and going there with love, the steadfast commitment to the well-being of others. The first step of partnership begins with building a team. AMOS trains and support promotoras like Timotea, who may only have a 4th grade education but have a heart and a mission to serve their most vulnerable neighbors. We teach them simple protocols to help save lives, such as preventing and treating diarrhea, a common cause of mortality in children in rural Nicaragua. And since malnutrition is the underlying cause of 50% of these preventable child deaths, Timotea is also trained to prevent, identify, and treat malnutrition. AMOS also trains volunteer leaders who can form a health committee that can prioritize health issues and work together with Timotea to improve the health of their communities. A key part of Socorro's job as an AMOS community facilitator is building relationships. This means Socorro fosters trust, makes sure we listen to the community, promotes mutual learning, nurtures safe spaces, and facilitates reflection and dialogue for community empowerment. Individual characteristics of each of the partners, like flexibility and a commitment to love, service, and cultural humility, also plays an important part in the development of strong partnerships. AMOS also helps to foster 3-way partnerships for sustainability between communities, governments, and outside facilitating organizations such as churches, universities, and other nonprofits. Each of these 3 partners have a role to play. It starts with a community which brings their strengths to promote bottom-up development. AMOS provides training in census-based healthcare. That means Timotea and her health committee map out every household in their community to identify the most vulnerable people to assure health equity. Government provides top-down policy and structure for the overall health system. In Nicaragua, the Government Ministry of Health, called MINSA, has a policy of universal health care, and AMOS and other community organizations coordinate with the MINSA to extend their reach to remote areas. Finally, outside facilitators like AMOS, along with our volunteers, churches, and university partners, provide training and support. Here, Socorro is facilitating trainings, encouraging and empowering community leaders, and supporting joint data collection and analysis. Building trust, sharing a long-term vision of serving the poor with love and humility, and forming equitable partnerships provides the foundation for program development, which is component number 3. To develop programs and interventions that are responsive and empowering to communities, AMOS follows 3 basic principles from Dr. Carl Taylor's seed scale model. Principle number 1, taking action based on local data. AMOS helps communities to collect and analyze their own local data using simple tools like simple graphs to track diarrhea and community maps to identify the most vulnerable people like malnourished children or children with anemia. Timotea and the Health Committee's own knowledge and understanding of the causes of malnutrition in San Onofre is key to this analysis. Here, Socorro is working with Timotea and her Health Committee to collect and analyze nutrition data that the community can use to take action, such as using the data to develop educational materials for nutritional counseling for mothers of malnourished children. This process is iterative and ongoing and helps communities to continually improve their programs and interventions. Community research is a powerful way that communities can make a difference using informed data to take action. At the AMOS headquarters, data from all the communities we work with is also compiled and analyzed during data parties, where we use data to make organizational decisions on how to best support and work with our communities. Here, Socorro is sharing data with the rest of our team at AMOS. Principle number 2, we train and empower community health promoters, health committees, volunteer mothers, and youth to continually build up their skills and abilities to help their communities. Principle number 3, we facilitate community participation and engagement for greater sustainability. Taking action based on local data, training and learning from each other, and community participation are all empowering processes that strengthen and increase the impact of activities that Timotea and her Health Committee do in their communities. Some of these activities include screening for malnutrition and anemia with health stations, growth monitoring and providing well baby care, organizing workshops for better nutrition, making sure children and families have enough to eat, coordinating with the government to make sure that children get their vaccines, and systematically visiting malnourished children in their own homes. So, if we start with an issue of importance to communities, analyze our context, partner well, and develop empowering programs and interventions that build upon all our strengths, we will hopefully have good social justice outcomes for improved health, which is the final component of the CBPR framework. Outcomes include short-term and medium-term health improvements, such as fewer children who are malnourished, mothers with skills to provide healthy meals for their children, sustainable programs and partnerships, and trained health promoters like Timotea and her Health Committee, who are organized to use data to take action to improve and transform the health of their communities. If we all partner together, communities, churches, governments, universities, volunteers, funders, and nonprofit organizations, bringing together all our strengths, resources, and love to reduce health inequities and transform communities, then that is social justice for us. And that is how we practice CBPR at AMOS with people like Socorro and Timotea.
El IAP es una herramienta de empoderamiento que nos sirve a nosotros como socios para conseguir mayor salud para todos, mayor justicia social en las comunidades.
So I'd like to end with a poem that my dad shared with me a long time ago when I was a child. It's from a Chinese poet, Lao Tzu, written over 2,000 years ago. It goes, "Go to the people, live with them, learn from them, love them, start with what they know, and build with what they have." So this is CBPR in a nutshell. It gives us strengths and it gives the people strengths, so that together we have the power to work towards health for all.